Vitamin D3 is a form of vitamin D used in the treatment of specific medical conditions such as refractory rickets, hypoparathyroidism, and familial hypophosphatemia, as well as osteoporosis and chronic kidney disease. In this video, let's found. What is calcitriol? What is calcitriol used for? Contraindication. What are the side effects of taking calcitriol? How does calcitriol work? How to use calcitriol? What is calcitriol? Calcitriol is the active form of vitamin D, normally made in the kidney. It is also known as 1,25-dihydroxycholecalciferol. It is a hormone which binds to and activates the vitamin D receptor in the nucleus of the cell, which then increases the expression of genes. Calcitriol was identified as the active form of vitamin D in 1971, and the drug was approved for medical use in the United States in 1978. It is available as a generic medication. In 2020, it was the 277th most commonly prescribed medicine in the United States, with more than 1 million prescriptions. It is on the World Health Organization's list of essential medicines. Vitamin D3 is a form of vitamin D used in the treatment of specific medical conditions such as refractory rickets, hypoparathyroidism, and familial hypophosphatemia, as well as osteoporosis and chronic kidney disease. In this video, let's found. What is calcitriol? What is calcitriol used for? Contraindication. What are the side effects of taking calcitriol? How does calcitriol work? How to use calcitriol? Vitamin D3 is a form of vitamin D used in the treatment of specific medical conditions such as refractory rickets, hypoparathyroidism, and familial hypophosphatemia, as well as osteoporosis and chronic kidney disease. In this video, let's found. What is calcitriol? What is calcitriol used for? Contraindication. What are the side effects of taking calcitriol? How does calcitriol work? How to use calcitriol? Side effects. The main adverse drug reaction associated with calcitriol therapy is hypercalcemia. Early symptoms include nausea, vomiting, constipation, anorexia, apathy, headache, thirst, pruritus, sweating, and/or polyuria. Compared to other vitamin D compounds in clinical use, cholecalciferol, ergocalciferol, calcitriol has a higher risk of inducing hypercalcemia. Pharmacodynamic. Calcitriol is a biologically active calciotropic hormone with anti-osteoporotic, immunomodulatory, anticarcinogenic, antipsoriatic, antioxidant, and mood modulatory activities. Its main sites of action are the intestine, bone, kidney, and parathyroid hormone. Calcitriol is a ligand for the vitamin D nuclear receptor, which is expressed in, but not limited to, gastrointestinal, GI, tissues, bones, and kidneys. As an active form of vitamin D3, calcitriol elevates the plasma levels of calcium by stimulating intestinal calcium uptake, increasing reabsorption of calcium by the kidneys, and possibly increasing the release of calcium from skeletal stores. The duration of pharmacologic activity of a single dose of exogenous calcitriol is expected to be about 3 to 5 days. Mechanism of action. The mechanism of action of calcitriol in the treatment of psoriasis is accounted for by their antiproliferative activity for keratinocytes and their stimulation of epidermal cell differentiation. The anticarcinogenic activity of the active form of calcitriol appears to be correlated with cellular vitamin receptor, VDR, levels. Vitamin D receptors belong to the superfamily of steroid hormone zinc finger receptors. VDRs selectively bind 1,25-OH, 2D3 and retinoic acid X receptor, RXR, to form a heterodimeric complex that interacts with specific D sequences known as vitamin D-responsive elements. VDRs are ligand-activated transcription factors. The receptors activate or repress the transcription of target genes upon binding their respective ligands. It is thought that the anticarcinogenic effect of calcitriol is mediated via VDRs in cells. The immunomodulatory activity of calcitriol is thought to be mediated by vitamin D receptors, VDRs, which are expressed constitutively in monocytes, but induced upon activation of T and B lymphocytes. 1,25-OH2D3 has also been found to enhance the activity of vitamin D receptor positive immune cells and to enhance the sensitivity of certain target cells to various cytokines secreted by immune cells. Half-life. After administration of single oral doses, the elimination half-life was 5 to 8 hours. Dose. Chronic renal dialysis-associated hypocalcemia. Oral. Initial, 0.25 micrograms PO/day to every other day, titrate by 0.5 to 1 mcg/day Q4-8 weeks. 4. Initial, 1 to 2 micrograms 4, 0.02 micrograms per kilogram, 3 times/week, adjust dose every 2 to 4 weeks. Maintenance, 0.5 to 4 micrograms 4, 3 times/week. Hypoparathyroidism/pseudohyperthyroidism. Initial, 0.25 micrograms PO/day, titrate by 0.25 micrograms Q2-4 weeks. Maintenance, 0.5 to 2 micrograms PO/day. Secondary hyperparathyroidism. Moderate to severe kidney disease. 0.25 micrograms per day PO, increased to 0.5 micrograms per day. Lower doses of 0.25 micrograms 3 to 4 times per week also used. Chronic renal dialysis. Oral. 0.25 micrograms q-day, may increase by 0.25 micrograms per day at 4 to 8 week intervals to 0.5 to 1 mcg/day. Patients with mildly decreased serum calcium levels may respond to 0.25 micrograms every other day. Intravenous. Initiate with caution, may consider 0.5 micrograms 3 times weekly approximately every other day or if necessary higher at 1 to 2 micrograms 3 times weekly approximately every other day. Adjust dose by 0.5 to 1 microgram at 2 to 4 week intervals. Maintenance, 0.5 to 4 micrograms 3 times weekly. Vitamin D dependent rickets, off-label. 1 microgram PO/day. Safety advice. U.S. FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about calcitriol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.